Today we're going to talk about therapeutic duplication and its relevance to clinical practice. Therapeutic duplication is a circumstance where there are multiple medications that are available to treat a particular problem, but there's no necessarily clear indication as to which medication should be used under a particular circumstance. So, for example, if you have two drugs to treat high blood pressure, such as labetalol and hydralazine, which agent is the one that is preferred for the nurse to give to the patient to treat that elevated blood pressure? In order to best treat the problem with therapeutic duplication, a more succinct order should be written, one that is very specific as to under which circumstances a drug is preferred over another. The Digital Intern fixes this problem by choosing a particular drug for a particular set of vital signs accordingly. And then as those vital signs change, adding or reducing either the same drug or new drugs as necessary. The Digital Intern allows the bedside nursing provider to get recommendations as to which drug may be optimal for a given circumstance. For example, a patient who comes in whose blood pressure is 200 over 160 with a heart rate of 120 may benefit more from labetalol than they would from, say, hydralazine. But given their history, they may need a combination of various different drugs to help control that blood pressure. And the Digital Intern is able to learn what the patient's individual needs are and respond accordingly. In doing so, this optimizes the physiology of the patient. And this is a very important issue to address. Instead of having a nurse go out and practice outside of her scope of practice and give a drug that may not be in line with best practice for that particular patient or that particular patient's need at that particular moment, the Digital Intern can help clarify which drug or combination of drugs is reasonable. There are certain circumstances where therapeutic duplication is actually indicated, not in the way that a person can randomly choose which drug to give, but rather a combination of drugs that should be given to best control, again, heart rate and blood pressure as an example. Digital Intern can tackle it for heart rate and blood pressure, but it also can tackle it for pain and agitation and nausea and vomiting and bowel management, etc. So the Digital Intern really does offer a platform for a standardized approach to patient problems, but very individualized medicine, adjusting each dose of a drug as needed, as well as the frequency and ramping up or scaling back those drugs as the patient shows that they do or do not need to have the drug present.